My name is David Stewart. I'm an interventional cardiologist with Franciscan Physician Network. I've known for a long time that I wanted to be a doctor growing up, but I fell in love with interventional cardiology during my training. I fell in love with the fact that it required a lot of high-paced critical thinking in emergency situations. There's nothing more rewarding or beneficial from my end than watching a patient who comes in with something like that be able to walk out in the next day or two with their family. My philosophy of care is to treat your patients the same way that you would want your loved ones to be treated. That involves sitting down, listening to the patient, hearing their complaint, getting to understand where they're coming from, making sure they're comfortable, making sure they understand what the next steps are, and then if that involves a procedure or a surgery, making sure that that patient is comfortable and understands what they're signing up for. And I want you to feel comfortable asking me any and all questions that you have. And I want you to view this as something that we treat together as a team. And the goal is dictated by what you're coming to see me for, but ultimately we want to restore your ability to go about your life without any issues, and hopefully without having to worry about any cardiovascular need. I'm excited to be a part of the Franciscan team. We now offer therapies in structural heart disease. This is a newer technology in cardiology. It allows us to treat valve issues with minimally invasive procedures. Whereas patients used to require open heart surgery to undergo valve therapy, now through modern medicine, we can offer minimally invasive procedures that allow the patient to get their valve procedure in under an hour and usually go home the next day. This is a very exciting thing that we offer here at Franciscan. Interventional cardiology dominates the hours. My interests outside of medicine usually revolve around traveling and spending time with family. General piece of advice for all patients, regardless of what you have going on, is that you need to be invested in your health, and that good outcomes are a byproduct of how much effort and care you take on your own body. And that requires you to pay attention to your blood pressure, pay attention to your labs, check in with your physician from time to time, and try to eat healthy and exercise frequently. If you do a lot of those small things that might seem like they're somewhat meaningless, over the course of your lifetime, it adds up and prevents a lot of things from happening down the road.